At some point in life, we all encounter cancer, whether it's directly or indirectly from those around us. And that's why this week I was super fortunate to spend time deep diving and talking with physiotherapist and exercise physiologist Jeremy Ingram. Now, Jeremy is deeply passionate about improving the health-related quality of life for those who are dealing with chronic pain and disease, and in particular cancer treatment. And he's created Western Integrated Health to meet this aim. We start off with Jeremy telling me about how he began his career, like many other physios, wanting to focus on professional football, and he's worked with Claremont and West Coast Eagles. It was during this time that he had another job, and out of left field, in this role, in this clinic, he was focusing on pain management, and this started the trajectory to where he is today. Jeremy is awesome at superbly presenting a wealth of knowledge and information and evidence in a super approachable manner. And he really goes deep on the role of exercise to counter the physical side effects of cancer treatment and how it plays a key role in improving survivorship from these episodes. He even talks about how the role of exercise can reduce the presence and release stuff in our body to kill off cancer cells, even in normal healthy people. But despite all this science, research and stats, there's a real key point about what Jeremy's talking about, which is that despite the situation, wherever you are in life, you personally can do stuff to take control and improve your own health, and in turn, turn the snowball effect of a significant life event, whether it's a career diagnosis or treatment, upwards instead of downwards. There's so much to learn about this. And like I said, whether you're directly or indirectly, or you haven't even had a brush with cancer, I would recommend listening to this because there's so much in there. So sit back and enjoy Jeremy. Hello and welcome back to WA Real. I'm your host, Bryn Edwards. Exploring the role of physiotherapy and special rehabilitation in relation to chronic disease and cancer treatment is where we're going today with my guest, Jeremy Ingram. Jeremy, welcome to the show.
Thanks, Bryn.
So one of the questions I like to ask my guests right out the traps, because it's called WA Real, is their relationship to WA. So you were born and raised here?
Born and bred in the hills.
In the
WA,
hills.
In the hills, and then the hills.
Yeah.
Yeah, so I'm pretty passionate about WA. I've always loved WA.
Why is that?
I just love the lifestyle. I'm someone, I get up super early in the morning to exercise. I get up at 3:40 every day. And exercise 3:40 every day to get my exercise out of the way.
People think I'm nuts for 4:20.
No, I normally start my first patient at 6 o'clock.
Yeah.
So I like to get up in the morning, have a coffee, quick meditation, going to do a workout or go for a run, and then start the day. Make a juice and then start the day.
What time did you go to bed?
About 8 o'clock.
Right.
It's become a bit of a concern because my 8-year-old, who's oldest of my 3 kids,
They're up longer than you.
is now starting to stay up a little bit later than me.
Right. That's in bed for 8 o'clock.
So, but yeah, so look, I love WA because I like the lifestyle, and I've got friends who say it's so sleepy and I don't like the nightlife, but I'm all about lifestyle and what's
Morning
happening
and
during the
daytime.
day and nature and
Yeah.
being, and you can't beat WA.
You can't. What was it like growing up here for you?
Yeah, my growing up was pretty interesting. I grew up in the hills, and we grew up in 15 acres, so we didn't have TV. A combination of, I think my mum just didn't really care too much for TV, and we lived in a valley, we couldn't get reception, so so I just roamed the hills really, read lots of books and did lots of exercise, and but then I left Kelmscott when I was 17 and lived on the coast ever since.
Yeah. Have you been away and travelled and come back? Or?
Yeah, for sure. I've been through India and Nepal and Bhutan and Europe, and lots of trips to Asia. And as much as I love travelling, I always love to come home.
Yeah.
Yeah.
Yeah. It's interesting because I meet a lot through this, asking this question, I meet a lot of people, and a lot of them, especially born in WA, they like to, they often go away for 5 or 10 years, and then it's I'm having kids now, brings them back.
Yeah.
But you just...
I look at it straight out of school. I lived in the Kimberleys for a few years.
Yeah.
Lived in a tent for, I think, 3 years, in between Derby and Fitzroy.
Yeah.
On a diamond exploration team. And I mean, that's fantastic country up there. That was amazing. And so I took a few years to decide what I was going to do, and decided manual work wasn't for me, and came back and did year 12 at that point.
Yeah, right.
Yeah. And I think tripled my original score, and then went to uni with the sole plan of becoming a PE teacher.
Yeah.
So I went and did sports science, or human movement at UWA, and just developed an interest in exercise physiology, and did honours in exercise physiology, and then swapped over to physio and left uni some 8 years later.
Yeah, you've done some interesting work with like Claremont Footy Club and the Eagles and various places before you get to Western Integrated Health.
Yeah.
There's a big theme in your background of obviously physicality, body, health. Where does that come from in the Jeremy story?
Yeah, two parts to it really, and I think 2 parts to my career, because I went to when I got interested in exercise physiology, it was all about becoming the strength and conditioning coach of a AFL side.
Right, that was the thing.
That was my goal, and then when I swapped over to physio and decided to do physio, it was to become a sports physio, and
still with the footy,
stuff. And
is that because that was the highest thing you could do with it at the time?
Footy was a passion, and sports was a passion, and probably as a young guy, that seemed pretty glamorous, and I did love, I did the strength and conditioning at Claremont Footy Club, and for years, for a decade, and I left uni, finished my masters in physio, and started working at West Coast, and a chronic pain clinic in Shenton Park concurrently. So I was part-time at West Coast and full-time at this chronic pain clinic, and just didn't enjoy the elite sports club atmosphere that much at all. Mind you, I joined the club 6 weeks after they'd won the premiership, already imagining, that last weekend in September the following year, going to the MCG and helping out the grand final, and as I think everyone's well aware, from 2007 onwards, the culture at West Coast Eagles probably wasn't fantastic, and so I joined them on top of the ladder and left them, I think, when they're 14th on the ladder, some 3 years later.
Right.
But in that time, I got exposed to, I was working with a very good team at a chronic pain practice in Shenton Park, and really started getting passionate about chronic pain, and I was with some really high level researchers, researchers in that space.
Is that sort of thing that sort of came out of left field? You didn't
completely, yeah.
You didn't realise that you were going to find it that interesting.
Yeah, completely, and it was a steep learning curve. So I mean, I guess when I came, going back to, I guess we were talking about being in the Kimberleys, I came back from working up north really unhealthy. I'd put on, I think, 22, 23 kilos with, that heavy drinking culture you get when 9 blokes living in a tent with no power in the middle of the Kimberleys. And the company paid for our alcohol. So we just worked really hard and drank really hard, and we'd work 9 or 10 weeks in the Kimberleys and 1 week back in Perth. And so I came back really unhealthy, and so I'd had a history with competitive Thai boxing or Muay Thai, and so I got back into that again because I just needed to lose weight and get healthier. And so that reignited my passion for exercise, and I did a personal training course then, and then put myself through night school, did year 12 whilst working as a personal trainer. So it's kind of, exercise was, super important to me at that point, and has been ever since. And but then it was about being fit and about being healthy and strong and toned. I was a young sort of guy, and I did a bit of competitive bodybuilding and all those kind of things. And then from, I'd say, 2008 onwards, I just became a lot more focused on health and how do I, as a physio, then starting role as a physio rather than a personal trainer or an exercise physiologist, I was like, how do I maintain health for people with these complex chronic pain conditions or chronic health conditions?
This is from your Shenton part.
Yeah. So I guess because they brought me on board there really to start an exercise program at that clinic, because they had a number of physios treating in rooms, and they had a space for a gym, but they didn't really have a gym program up and running. So with the dual qualification of ex-phys, exercise physiology and physio, they wanted someone to come on board and start, because physio by then was moving to very much an exercise-based approach to physio rather than ultrasound and TENS machines and dry needling and those kind of symptomatic treatment.
Yes.
So we were starting to move towards, I guess, using exercise as a means of managing patients' symptoms. But I developed a passion, I guess, in not just using it as a means to improve symptoms, but to improve health. Like for people who've often lost their health because of pain or disease, and they don't know what to do. They're scared that what they do is going to make them worse, or they're not. Yeah. So
was that kind of new stuff at that time?
I think it's been new in the physio space to that sort of shift to being that exercise based. Often exercises were something you gave someone at the end of a treatment session after you've massaged them and mobilised joints and done whatever. You give people draw a few stick figures of a few stretches to do to try and maintain the benefits of what you've done with them until you see them again. So I think I think it is something that's new, and I still think it's probably not a huge focus on physio, like the looking at health as looking at patients' overall general health rather than just symptomatic management.
More holistic view of things.
And because invariably most of the people, when certainly working in a chronic pain space or chronic disease, cancer place, most of the people I see are terribly deconditioned, and either that's been one of the driving forces behind why they're so unwell in the first place, or it's been a sequelae of their condition. So, and I think we do people an enormous disservice if we don't think about how we can improve their overall health.
Yes.
Yeah.
So, how did you go from there, or where are you now with like Western Integrated Health and what you do there specifically now?
Sure.
I'm particularly interested with the physio playing a role, particularly in like cancer treatment and stuff like that.
So I operate from two places. I've set up in 2016. I set up my own clinic in Subiaco, which is Western Integrated Health, and with the 90% of the clinic's gym space, and with 3 small treatment rooms, and so just to allow me to really focus on being able to deliver targeted and safe exercise programs for people with complex health needs, and so the 3 main patient groups I'm seeing there are patients who are receiving treatment for cancer or recovering from cancer treatment, and complex chronic pain patients with sort of either they've had injuries or they've got systemic inflammatory conditions, rheumatoid arthritis and fibromyalgia, and then chronic disease patients, and with a lot of people with multiple metabolic conditions and heart disease and heart disease, neurological conditions, Parkinson's.
Are they the third group?
Yeah. And then I have a pile of patients for who they tick all those boxes, or they tick 2 out of the 3 boxes, so they've got a mixture of chronic disease, chronic pain, and cancer treatment. I don't really see any routine sports injuries or hamstring strains. They're all fairly complex.
So, in your view, what role does this play in people's recovery back to health?
Yeah. So, I mean, it's different across all those conditions. So, I mean, if we take the chronic pain patient first, really, we need to empower patients to be able to manage their condition, like to self-manage their condition, because with any chronic condition, a big part of it for patients, I think, is the loss of control. Like, they lose control of their health, and it's a really scary place to be in, where you don't feel like you're in control of your health. Either someone's given you a substance, some sort of external substance that you need in order to be able to function, whether it's a muscle relaxant, a painkiller. So people lose control, like
of their actual body.
Yeah, and and then their belief that they're so in their sort of their self-efficacy. So their innate belief that they can handle various either psychological events or physiological events, or and so the window in which those people operate becomes smaller and smaller and smaller, because it's the nature of giving people benzodiazepines or opioid pain management and things like that. Is initially people have some severe event of severe pain and they have to take some painkiller to be able to manage it, and then then the threshold at which they need to take some sort of substance or have some sort of intervention to be able to cope becomes smaller and smaller, and so their life becomes
dependent.
Yeah, but it also becomes like the space in which they operate becomes into a bit of a vacuum where suddenly they're afraid to leave the house, they're afraid to lift their grandkids, they're afraid to because they just don't know. They lose their sort of resilience to be able to cope with those things. So part of what we do,
that would really play at someone's confidence.
Yeah, and I mean, and people, there's a lot of anxiety, then health-related anxiety around that sort of stuff, and a lot of anxiety is around lack of control, and people feel like they're not in control because they need to make sure that they can see their specialist, and they've always got the scripts filled, because if they don't have that medication, then they can't cope because they don't have their own internal coping mechanism. So part of what we do with the exercise, apart from trying to get people fit and healthy, and is exposing them gradually to things that they find scary, and so it's almost like because people develop phobias. Basically, they might have a phobia of bending forward because they've been told by a health professional, they've taken an MRI and said, "You've got the back of an 80-year-old, Bryn." And you're like, "Well, I'm 40 years old, my back's going to crumble. I just need to stop." And they just freeze up and they stop doing anything. So part of it, and a lot of that's not based on evidence. Like we know the best evidence for people is to keep them moving as much as possible. So we start exposing them to doing things that they've avoided doing, but in a safe way. We make sure that they've got, we get them strong and that they're physically able to do those things. And then slowly in a controlled environment, we get them to, if we know, your goal is to, if you had a lot of things we see is, say, someone around their grandchild, they might want to pick up their 18-month-old grandchild, and the grandchild weighs 15 kilos, so we might start them off in the gym learning how to pick up a 2-kilo dumbbell, and then a 6-kilo, and then an 8-kilo dumbbell, and learning how to do it, and they're like, "Oh, I actually can do that." And then they start moving in a way that's safer and less provocative for their pain, because they're not bracing and tensing and holding their breath and wincing, and so then we get people to be able to reproduce those sort of movements first in a safe environment in the clinic, but then at home. And so at the end of the day, we need people to be able to self-manage their condition at home. So the end goal is for people to be able to go out, whether they need to join a gym in the community. For a lot of people, we can set them up with some exercises and movements and they can do at home, and then both to improve their function but also to manage their symptoms. So they go, my back's twinged, I know what I can do, I can lie down, I can do some tail tucks, some knee rolls, and on my own I can get rid of that symptom, I can reduce it, and then they grow in confidence and and they can re-engage in life again.
Negative snowball in suddenly becomes negative snowball positive out.
It sort of snowballs in the other way. They start going, I actually can do that, and then they do a little bit more and they go, I can do that.
Yeah.
And so suddenly the whole world expands again, where they can go, I can go to family dinners, I can sit down in a restaurant without my back hurting for 2 hours. Maybe I can hop in the plane and go on that European trip that I've wanted to, because if I do have a flare-up of my back pain over there, I've got my set of tools, I know what to do. I can pop a heat pack on, I can do my stretches, I can go for a walk, I can hop on a bike. And so for that sort of people, it's kind of about, and that's part of health, is having a meaningful quality of life. It's not just the absence of disease, it's kind of being...
And that's something that springs to mind, that absence of disease, because it strikes me, I mean, I watched my father although he's over in England, but just talking, and when he came over and I was over there, he had a kidney removed for suspected cancer and found it, and then he had rounds of chemotherapy. Now, my dad's a big dude, right? He's a big, thick-set guy. He would have been in his early, mid-60s when he did it, but he's just got like 60 years of strength and being on the planet contained within him. Sure, he's not as strong as he was when he was in his 30s or 40s, but he's just a residually strong guy. And then all of a sudden it just went.
Yeah.
And he still looks like the same guy, but he wasn't, he couldn't quite do the DIY stuff he wanted to, and this, that, and the other. And then there were several times when he was having a go at it because his mind was still at it, and he'd fall and trip and gash himself, and then that led him, and as my mother pointed out, he lost a bit of self-confidence in there because he was dad and he had this strength, and that was part of who he was. And then it took going back to the gym and bit by bit. I mean, I don't know whether he's got it to the same level, only he knows that. But walking, cycling, going to the gym, playing golf, important things to him.
And it's a really common story, a really common picture and particularly with the oncology patients, because it's one of the things I'm really focusing and promoting at the moment, because I've just set up a clinic and a small gym in a new haematology and oncology cancer hospital in West Perth. And
just where I go for my hemochromatosis nowadays.
So it's with the team there. They're called Western Haematology and Oncology Clinics, and Ross Baker, who's a haematologist, heads up that clinic there. And so what we're looking at, because we know when people get treated for cancer, there's a pile of really common side effects. Well, in fact, everyone who gets treated with chemotherapy, and in 6 months of chemotherapy, we know they're going to lose 15% of their lean muscle mass. Yeah. They're going to lose, they develop these peripheral neuropathies where the nerves in their hands and feet get affected, and so they can't feel where their feet are. They start falling over.
Right.
They often get...
my dad.
Yeah, so they start getting... Often they get anemic and they get short of breath. And there's this whole pile of physical deconditioning that we know is going to happen.
Just knows that happens.
We know, with the haematology patients who are with multiple myeloma and some of these blood cancers, they're on chemotherapy regimes now. That I've got patients that have been for over 2 years of continuous chemo to manage these blood cancers. So there's this whole raft of side effects that happens to them, and what happens most commonly is patients get referred to me as part of an oncology program when they've lost 20 or 30 kilos, they can hardly walk, they're falling over, they're about to cease treatment because they've become too unwell and they've lost too much, and then they refer them for a strength program and say, can you try and put some muscle mass back in this person so they're robust enough to maintain to re-engage in treatment again. And so, I mean, the idea with this gym in the hospital in West Perth is that exercise will be embedded into part of their cancer treatment from the very start.
So you don't get to that point.
Because Rob Newton and his team at ECU have been doing some really groundbreaking research in that area, and they do DEXA studies on patients who...
What's a DEXA study?
So it's a scan where that basically takes your total body composition, bone density, muscle, how many grams of muscle you've got in each limb. It's a really specific scan, and it's the gold standard for body composition. And they have control groups and intervention groups where the control group doesn't engage in an exercise program, and they start their normal chemotherapy program for either prostate or breast cancer. And the intervention group has been doing a structured exercise program through the ECU gym. And the people who engage in the exercise program from the start of treatment maintain their muscle mass. They don't lose any, and some patients put on muscle mass whilst going through treatment, whereas the intervention group lose muscle mass. They lose bone density. So a lot of time people come out, men and women become really osteoporotic as well, and so they're at increased falls risk because they can't feel their feet. The bone density's shot, so that's just and we know that exercise mitigates almost all those side effects, from the neuropathies to the bone density and to the
what else would
and so we're just trying to embed that early into treatment before patients get really unwell. And apart from mitigating the side effects, the trials are showing an improved 5-year survival outcomes between 30 and 40% for for prostate cancer and breast cancer, which is it's pretty amazing. I mean, that's sort of equivalent to a lot of the interventions, the medical interventions that people are having. The improvement in survival rates with some of the chemotherapies patients are having is around 40%, 40 or 50%. So you're talking about a standalone medical intervention that's improving survival outcomes in cancer patients. So
is it speeding up recovery or?
Well, I mean, from treatment, do you mean?
Yeah.
So definitely
to get
speeds
to the
up.
point of not needing chemotherapy and moving on.
Oh, I mean,
or is it?
It's not so much. It's certainly not an alternative to chemotherapy.
No, I was about to say.
You've
got a nasty cancer. You might as well go and crack some sessions in the gym. No,
certainly not. But interestingly, I mean, exercise has shown to have an effect on cancer cells on its own. So they've done studies in 2013 and 2016 where they got 10 healthy men on, and they took blood from them before they hopped on an exercise bike, and blood once they hopped off the exercise bike, and they extract the serum from the blood, and then they marinate different types of cancer cells in the serum over 96 hours before they inject them into mice, genetically identical mice. And they show that the prostate cancer cells sitting in the post-exercise serum shrunk by about 31% over 96 hours compared to the cells that were in the pre-exercise serum.
Right.
And so the chemical change in blood as a result of an acute bout of exercise actually has an effect on shrinking, inhibiting the growth of cancer cells. So and they analyse the serum, like the blood serum, and they show that exercise activates these like our own immune cells. They've got these cells that are produced by our muscles. There's cytokines called interleukin-6 that help target cancer cells, and then the body releases these natural killer cells that actually infiltrate and destroy cancer cells on their own. And
without the need for anything externally.
So they've duplicated those studies with melanoma and lung cancer and like 5 different strains of established lines of human cancer cells. So there's chemicals that are produced by your body when you're exercising that have...
That are provoked by exercise.
That, released purely by exercise that attack cancer cells.
Yeah.
And which explains why we know that people that are physically active, got a 40% less reduced likelihood of developing cancer in the first place.
In any shape.
Yeah. But now we're actually nutting out what's happening in the body biologically, physiologically, chemically that has a cancer fighting effect. So it appears that the exercise on its own is helping the body fight cancer as well as, but certainly being able to adhere to your medical regime as well. So if the oncologist sits down and you go, the ideal dose of chemotherapy, radiotherapy, immunotherapy is, whatever it is a certain regime, and that's going to give you the best chances of survival. But we know if people exercise throughout treatment, they're more likely to be able to adhere to their routine, and they're not going to have to otherwise the oncologists have to reduce the dose of chemo. They have to cease chemo for a while people's red blood cell count gets back on board, or their muscle mass gets back on board, they're losing too much weight, or they're getting too nauseous and fatigued.
Like you said earlier on, when you get people who are right at the bottom, can you do something with them? It can take a while as opposed to...
And so being able to adhere to your medication regime also improves your survival outcomes. And they've done some studies looking at, because part of the exercise we do now is exercising immediately before people have chemotherapy or radiotherapy.
Yeah, given what you were saying before.
Yeah, but I mean, the other part of that is that it actually helps because a lot of solid tumours have got really poor blood supply. So exercising, we know that exercise increases blood flow to the tumours, and so you get better drug delivery of the chemotherapy or radiotherapy to the tumours themselves.
Right.
And the oxygen, they think there's something about, the oxygenation of the tumour cells that increases uptake as well so you get better drug delivery, you get better uptake of the drug into the tumour cells, and so the actual...
Does it sit here and listen to it, or just make sense?
Yeah, so the actual, the body responds better, you get a better response to the treatment if you've exercised immediately before or immediately after you have the treatment administered.
So when we say exercise, there's cardio, weights, mobility stuff.
Yeah, so and it depends a little bit on the nature of the cancer as well that they're treating. But certainly the exercise immediately before chemotherapy, I think is a combination of aerobic exercise and potentially, if it's a tumour where we can target blood flow to that site, whether if it's breast cancer, we can get people doing exercises that target blood flow to breast tissue.
Get them on the pack deck. Do
but I certainly think the cardio exercise, aerobic exercise, is an important part of that. Yeah, that protocol.
Just overall blood flow around the bit.
Yeah, but in terms of the exercise in between chemo or radiotherapy, I think strength training is really important. Targeted strength training and balance training, because losing muscle mass is such a well documented side effect of all those treatments, and such a debilitating effect on function. And then, the exercise gets targeted as well, depending on, like for prostate cancer and breast cancer, people also have androgen deprivation therapy, where they block testosterone or block estrogen because they accelerate the growth of breast cancer or prostate cancer cells. But part of blocking testosterone in a male is they lose all their muscle mass, they lose bone density, and they have deterioration in mood and all those, and a whole other raft of side effects. And likewise with estrogen, has a similar effect on women. And again, we can mitigate a lot of those effects. We can do targeted exercise for bone density, and the studies show that we can really offset that loss of bone density.
deadlifts and stuff.
No, it's more high impact. I mean, you know, the studies with prostate cancer men, they're setting up little hurdles and getting them jumping over the, you know, they've got these 70, 80-year-old guys jumping over little hurdles to get the high impact loading through the bones. That's really what stimulates bone density. So we get people doing sort of aggressive foot stomping exercises and I
was going to say, are the exercises similar to the ones we'd see if I just went into a regular gym, or are they really quite specific? I mean, I don't think I'd see many people aggressively foot stomping, but...
No, they're pretty specific. Because a lot of people with, you know, if we're still talking about cancer, a lot of people they've either got considerations where they've got mets, bony mets in, you know, so they've had cancer in different parts of their spine or their hip, and so you've got to consider, or they've had surgery, you know, with breast cancer, they've had surgery where they've taken muscle grafts out of their lats, or, you know, they made a big flap to use for reconstructive surgery, and so there's a lot of, and often patients are really frail, and and you have to be really careful. Like, I'm monitoring people's heart rate, their oxygen saturation, their blood pressure while they're you know, I've got to they're a high risk patient group. They need to be managed carefully. To start off with, I've always got, you know, I've got a defibrillator nearby, trained, ready. So we take, you know, it's something that needs to be, I think, certainly in the early stages, it needs to be quite specific, and I'll take an hour to assess people initially and work out what's appropriate for them. And once I've got an idea in my head of what I think their starting point could be, I normally start them at 50% less than that point, because you can always increase what they're doing, but if you start them too hard,
you'll smash them.
Yeah, well, I mean, you can either injure them or you can make them really fatigued, and either way, it's a sort of, you disincentivize them to continue because they just find it too hard. And you're dealing with a bunch of people that are going through a horrendous time, like hearing, you know, getting the diagnosis that you've got cancer, and often your life's taken over by medical appointments, and it's a pretty overwhelming time. So you want to use exercise in a way that's supportive and nurturing for people, and it's, again, empowering them to at least have a facet of their life where they can take charge of again. And and when you explain to people, you know, what the research shows, that people feel quite motivated because they feel like, again, it's something that they can take charge of again. And they can do something that's going to improve their survival outcomes. And also, I mean, I get a lot of people for whom, you know, with stage 4 cancer, with, you know, terminal cancer, and they might only have 6 months to live, or 3 months to live, but then the focus is on trying to improve their quality of life during that time as part of a palliative care regime as well. And, you know, I had a gentleman recently with a young man with young kids, and he I think he probably lived for 4 months once he started with me, but in that time he still got a lot of benefit in the exercise, which he relayed back to me.
What sort of benefits would he get?
Just being able to engage with his kids and stuff like that, like to be able to lift up his kids and kind of be able to, you know, go down to Auskick with them a few more times, you know, for another 5 times and stuff like that, which is pretty important when you're... So that's sort of the, I guess, the, you know, you're not looking at survival outcomes then, but you're very much looking at the health related, you know, the quality of life related stuff, which is a big part of, you know, what you're trying to do for people. It's kind of not just about lifespan, it's about health span. You know, what because I guess none of us know how long we've got left either, and it's about helping people to maximise their quality of...
Is the role of exercise as part of this treatment. Is it a widespread diagnosed thing or suggested thing, or is this quite on the edge that you're doing here at the moment?
Look, I'd say, I mean, again, Rob Newton would is the man who's really been one of the world pioneers in pushing exercise in oncology as, you know, a part of cancer care. And it's been, I mean, the research now is pretty overwhelmingly, you know, positive about it. Like, there's no doubt it plays an important part. But to go from research into practice takes, the wheels turn quite slowly, and it potentially takes a generation of consultants to roll over before they start seeing the value in it. And so the Clinical Oncology Society of Australia, which is, you know, the peak body for oncologists, issued a position statement saying that exercise needs to be embedded as a standard part of cancer care, and that best practice cancer care, I think I'm quoting fairly accurately now, needs to involve a referral to either an accredited exercise physiologist or a physio with experience in cancer care.
Yeah.
So their governing body has said, like, the evidence has accepted that the evidence is overwhelmingly in favour of exercise. Yeah. You know, being but there's some probably practical and financial implications into embedding it into practice, because the treatment centres don't make any money from prescribing exercise or referring people to allied healthcare. I mean, they've got huge overheads, and they get their money either from, you know, really expensive drug treatments, and some of the medications are, you know, for immunotherapy, it can be $10,000 or $15,000 a dose, and so you're talking about really. So from embedding it into a business model can be challenging for them, because they don't like it. Trying to allocate funds for it can be challenging, because it just doesn't generate revenue. And I think the oncologists are super busy, and so their treatment times are really narrow, and they're doing the best they can to keep their patients alive. And they've got a lot of
within the focus of what they know.
Yeah, and so look, I think it's growing, and I think, you know, Ross Baker and the team at Western Haematology and Oncology, they built this hospital with the space.
Did they reach out
to
you?
Gym? Yeah, and they reached out to me from the inception of that place to embed exercise as part of
cool.
their. Yeah, so that's really good, really exciting, and you know, they're a lead of their team of sort of world class researchers. They're doing a lot of clinical trials there, and I think, you know, Ross Baker's been the principal investigator in over 100 clinical trials, and so it's really exciting, and they're interested in, you know, starting to get some really objective data, taking blood tests and objective scans from patients, pre-exercise intervention and post-exercise intervention. And I mean, I think, you know, they've got a patient group who particularly benefit from it, because they're on treatment for so long compared to solid mass tumours, where people might have 6 months of chemotherapy. You're talking about people that really have got no end in sight for, you know, they're 2 or 3 years into solid chemotherapy and steroid routines. So I think it is growing, and the amount of referrals I'm getting for it is definitely increasing. I'm across the road from the Bendat Cancer Care Centre, and they're some of their oncologists there, and are starting to refer a lot more to me.
Awesome.
Yeah.
It's a long way from I'll get into physio so I can work with sports stars,
Yeah.
to actually a real fine percentage of the population that have a particular requirement. Have you ever reflected on that?
Yeah, I do, and
This must be a really meaningful and gives you a lot from doing it.
Yeah, it's been and it hasn't really been. It certainly wasn't the way I planned it. It's very much happened organically. My the chronic pain work was a bit of an aside to the job at West Coast, and then became my passion. The oncology work really grew organically out of the fact that I had a lot of middle-aged to elderly patients who got diagnosed with cancer while I was working with them in the gym already for chronic pain issues. So I developed an interest in how to start researching how to manage their conditions as they came through. And I think my first, I remember my first patient who had the Whipple's procedure for pancreatic cancer, and so I started researching, the evidence around, or best management from an exercise point of view for that particular patient, and it's just, it just grew into, it's just organically grown as a passion for myself. And then when I set up Western Integrated Health, and I'm sort of nestled between Genesis Cancer Care Hospital and the Bendat Cancer Care Centre, and I already had that strong interest in oncology, and I was seeing a lot of people walk past with their bandanas on the way to treatment, and so I just started, I guess, trying to focus on helping those people engage in exercise as part of their treatment, and then it's just grown a head of steam from there. But it's quite similar, very similar principles to managing a chronic pain or a chronic fatigue or a fibromyalgia patient, or people with rheumatoid arthritis dealing with cancer patients, because it's all about slowly building up strength and aerobic fitness, and teaching patients how to pace themselves, because they've generally only got a certain amount of energy chips they can cash over a day. And so you've got to teach them how to
manage that.
Yeah, cash them in a way that's going to help them, generate more energy chips, and to do it, and being cognizant, I guess, of the fact that they might still be holding down a job, or they've got to be able to go home and cook dinner for their family, or whatever it is. So there's been a lot of overlap from the different treatments. Probably the biggest steepest learning curve was going from a strength and conditioning role at football clubs to exercising chronic pain patients, and having to rein in my enthusiasm for prescribing exercise quite a bit to avoid flaring patients up. But yeah, it's been an interesting journey.
You must have had some great stories and great results.
For sure.
With individual cases.
Yeah, and it's it's fantastic to see. I guess just to see people engage back in life again, whether it's being able to get someone back to work again, or to be able to do some sort of other meaningful activity that to something that's really meaningful to them, and with that sort of approach, because we at the start of treatment, we sit down with people and identify their goals, like, what do you want to get out of coming to see me, and what is it that you're not able to do at the moment because of your condition. And so we get a little bit of a list, and then I guess as part of treatment, then we tend to focus more on how you're going with achieving your goals, and we might have to break down, if the goal again was picking up your grandkid, we might have to break that down into segmental parts. So it might be, doing a quarter squat down and standing up again, and doing that for a few weeks and breaking it down into little segments until you're going to your goal, which is actually picking the grandkid up and throwing them over your head or whatever you're doing. But because when patients have had pain for a while, they become very focused on their pain, and they're always going. And physios and
trying not to trigger
health specialists will reinforce that because I say, does it hurt when you do that? Can you give me a score out of 10? If 0's being no pain at all and 10's being run over by a train, how much does it hurt when you bend forward or when you bend your knee or when you do that? And we get people doing an exercise saying, oh, does it hurt when you do that? Does it hurt when you do that? And the patients are rubbing it and they're feeling it and say, yeah, I think it hurts. I know. And when you look at the research around that, they take functional MRIs of people's brains and it shows how your brain lights up in response to different stimulus. So I'll show you, for instance, for someone who's with back pain, that the part in their sensory cortex of their brain that's normally is a very small part of our brain's resources allocated to feedback from our back, like all the resources are allocated to our fingers or our tongue or our sensory organs. When you look at someone with chronic pain and they do a scan in their brain, there's this huge amount of resources allocated to that part of their body, so they're paying attention to it all the time. They're getting a lot more feedback from it. So then for every little stimulus that comes there, whether it's a painful stimulus, they get this really over-exaggerated response in their brain. So if we can get people to focus on some sort of outcome that means something to them rather than on the pain. So I try not to ask people about their pain. Like I just say, how are you going with your squats? How did you go with, you're walking your 500 metres up and down the footpath every day and you're whatever it is. And so when people start...
things that they can do.
Yeah, they sort of stop being so myopic on what's going on in their back, and they start thinking about, I'm back, I'm going to do school pickup today. I'm going to pick the grandkids up from school. I'm going to take them home. They become a bit more outwardly focused. And then suddenly, a few months later, you say, oh, by the way, how's your back going? They go, oh, actually, no, I haven't felt it for a while. And so it's actually, and there's pretty good research that approach is a lot better for people to focus on function. So you become
it's
more...
as simple as that. Don't think of a pink elephant. You've got to think about the pink elephant. How's the pain? Are you thinking about pain?
Because I often get someone come in and say, I've got really sore through my shoulder here. It just really hurts when I do this. I say, when else does it hurt? And they say, oh no, it just hurts when I do this. I say, well, stop doing that. Because people just become really focused. And they just always play with it. They spend all the time in. You can see that, and probably people that inherently have an underlying predisposition to being anxious and being in that fight, flight, or fright state where you're scanning. And with fight, flight, or fright, you can be scanning the environment looking for danger. But for people with pain, they start scanning their bodies looking for danger. Yeah. So they're constantly
similar sort of thing. Yeah. Just internally,
and so. Which I guess is also part of an important part of treatment too, is then teaching people how to down-regulate to come out of that fight, flight or fright. So mindfulness and meditation is an important part of what I do, as well as exercise.
Get them to sit still and just
sit still, and to be able to sit with uncomfortable feelings, and just learning how to down-regulate their nervous system through breathing and it's a pretty, and it's just picking which patient needs which proportion of which sorts of treatments you're going to allocate for any given patient. Some people might be really high on anxiety scores, and we screen them when they come in with a few questionnaires. And so then the treatment becomes spend a lot of time talking about down-regulation and mindfulness and meditation, and I often get people to use different apps where they can go out and do daily programs, and we can get a measurement, like it records each time they do it, so I can
see what they're up to.
See what they're up to, and or some people really don't rate that highly, and you can tell straight away that they're not that fearful, they're not catastrophizing, and so we go much more down an exercise, but get straight into they're a fairly complex group to work with, and
because there's so much other things going on, which is triggering them.
Yeah. So, which I guess why physio, as part of the exercise-based approach, they now call our model, as biopsychosocial model of physio, where we're trying to address, if we need to, people's biology and their structures, but we're also trying to look at their thought and patterns, their beliefs, their psychological profile, as well as looking at their social. I was
going to ask the
context.
role between that and the actual physicality of what you're doing, because I can see how just by the doing of the exercise would start to build that belief, but then I can imagine it would go even quicker if there was a belief there in the first place.
For sure. I mean, I think chronic pain is a lot more about psychology and beliefs than it is about physical structures these days, because we know the correlation between damaged tissue and pain is very low. Like we look at the
correlation between damaged tissue and pain is very low.
Yeah, so we know that like a MRI results are poorly predictive of pain. There's only like a 20% correlation between MRI findings and patient symptoms.
Right.
So we know by the time people are 45 years old, if you get healthy people with no history of back pain and take an MRI at the back, 90% of them who've got bulging discs, degenerative joint disease, and they've never had any history of back pain. So basically, by the time we've got wrinkles on our face, we've got wrinkles in their collagen fibres throughout our body. So
and then you get told this.
Yeah, and then people, they go in and they sprain their back, and so someone orders an MRI from them, and it comes up with these, and that's the classic thing you get told. You've got the back of an 80-year-old because it shows you've got some wear and tear, L4-5, L5-S1, and like everyone's got wear and tear at L4, L5, and it probably was there way before they had this episode of back pain. But then people, it becomes to that fear thing. So then people believe that underlying structures are damaged and they need to protect them. And so a lot of it, when people come in, is trying to unring that bell and instill some confidence in people to say, your structures are fine and your back looks better than mine does in an MRI. And, people, this isn't predictive of disability for you, and it may not be the cause. Like, from everything I'm seeing from my physical examination, is your pain's coming from L5-S1, and your scan says you've got some degeneration L2-3. So it's probably unrelated, and it's just an incidental finding. And so we just need to get you to relax and move and re-engage in life, and then generally people get better. So a lot of it is because with that pain and with the fear becomes a whole pile of maladaptive movements, and people just start moving in a way that perpetuates their pain cycle. So it becomes just a snowball of disability, and there's a whole area of research dedicated to the pain and disability that are caused by the advice people get from health professionals. It's called iatrogenic pain disorders, which is basically a health professional induced disability.
Just listening to you, what a healthcare professional says at that key moment when you're about to deliver the result of a test or a scan or something like that, when they're all ears, they're super receptive, and then boom, there it is. That can send them off on a whole trajectory.
For sure, we see it all the time.
Super careful about your words.
It's really common. It can be so damaging. You can either completely reassure and reduce someone's pain and disability, or it can go the other way completely.
Back of an 80-year-old is not a great sounding.
It happens all the time. And it's really scary, and it's a really hard bell to unring, and particularly if it's come from a consultant or someone's trusted, family GP, because a lot of, particularly perhaps certain nationalities and people of a certain generation too, there's a hierarchy of where they take their medical advice from, and so they come and see a physio, but they've already been told by their GP that their back's damaged and they need to protect it, and they need to avoid walking and bending and all these kind of things, and it's really hard, and it is about gradually changing people's beliefs. It's probably the most important thing we can do for our patient is change their beliefs, and particularly if they're, because there's very, very, very few musculoskeletal conditions where exercise isn't the most appropriate form of treatment. But people are all the time told by health professionals that they need to stop exercising. It's pretty frustrating, but and I think it's slowly changing. And again, I think it's a generational thing. I think doctors being trained now are learning this stuff as part of their
so just be their norm.
As part of their training. But I think unless people keep up to date with, and in the defence, to say, of the average GP, it's hard to keep abreast of the research across all the different spheres of medicine they need to do, as well as musculoskeletal. But the best thing they can do is probably refer them on to physios and not scan them unless they absolutely need it. Yeah.
In fact, I myself have been told once before by physio chiro, I could send you for a scan, but I'm not going to because I'll just do your head in if you do it.
Yeah.
So I've heard that story, or it's been that warning before.
Yeah.
We're not going to send you for a scan on your back.
And it generally doesn't. I mean, people are often disappointed because they come in with a $600 MRI and have a little glance at it, but it doesn't really direct treatment a lot of the time, unless there's some, there's some specific pathology in which. But there's very clear criteria for MRIs, and most of the time when people get them, they don't meet that criteria. Just means that, I've got non-specific lower back pain. Let's try and find out what's going on by ordering an MRI, and then.
Sounds like a cottage industry.
Yeah.
So what have you learned about yourself through all of this?
I learn a lot about myself, I guess, through having to think about the advice I give my patients, because I've learned how important my health is to myself, and how structuring exercise and meditation and time to eat properly and time to spend with my kids into my working life is really important, because I see a lot of people who have let all of that go in order to pursue their career, and that's been the genesis of this, the deterioration in their health. And so I've kind of learnt, I guess, more and more how much health means to me, and how much I value my health, because I see a lot of people that have lost their health. And
does it help you to define what health means for Jeremy?
Yeah, for sure.
Not just physically.
Yeah, it does. When I go out for a run most days and I'm jogging along the coast, I'm always just thinking I'm so grateful to be able to do this stuff, and to 45 years old, to have a body that still works well, and because seeing people that have lost their health, sometimes through poor lifestyle choices, and sometimes just through being dealt a bad card, in terms of, makes you realise that you never know as well what is around the corner for us. And it makes me take time to spend with my kids while they're, like, I've got 3 little kids, they're 2, 5 and 8, and I 3 days a week I make sure I finish work on time to go and pick them up from school pick up, and I do school drop off another 2 days a week, and I don't work on weekends. And a lot of that stuff is because I see people who go, I'm just going to smash out work during this earning window of my life from 30 to 50. I'll pay off my mortgage, I'll get my super, and then I'll back it off, and then I'll be alright. And then I'll be alright. And they either don't get to that point because something happens, and so they've missed that opportunity, or they hit 50, they've lost their health, they've lost their ability, their kids have grown up, want nothing to do with them, they've kind of missed
Yeah.
So it really makes me stay in the present and try and enjoy everything I've got like in my life right now, and to try and make the most of it, because you just don't know. You know, you got to live each day like it's, to an extent, like it's your last. Yeah. So it really makes me value my health, and
particularly being around the clients that you have.
Yeah. And you know, a few years ago I was pretty unwell with an autoimmune condition, and it was just while I was setting up Western Integrated Health actually, and just working massive hours, and got quite unwell. Like my lungs weren't working well at all. I had pneumonia, and my heart function was down. I was seeing, and it was really probably at that point that I had to. I just found myself getting caught up in that rut of working 80, 90 hours a week, and all about the business, and my health got really bad, and so I had to just sort of take time to to keep my life in balance, and to figure out I can only function while I've got my health. If I don't have my health, I don't have anything else in my life. Like, life's this pyramid that's so built on the platform of having your health, and if you don't have your health, they say, like, people that don't make time for their health are going to make time to be sick, and I
love that.
And it almost cost me everything, because I got really unwell, and I had to take a couple of months off work. Had a new business that had just started, so I had no revenue coming in for a couple of months. I had a newborn baby, and doctors telling me my heart's working at 40% of my age predicted norm, and trying to figure out what was going on, and on some of those treatments that my patients are on now, on the steroid, and the prednisolone for all this kind of stuff. Right. And so I really had to go back to working out what I needed, almost seeing myself as a patient. I had to go and see a dietitian who sorted out, my eating had got out of hand. I wasn't sleeping. I wasn't exercising, and so I had to use myself, like, sort of take a step back, but that kind of that really changed that episode, and it was probably close to 4 years ago now. And that really changed the way I treated patients too, because it really made me appreciate that in order for our bodies to function, we need to have periods of going to rest, digest, and repair. We can't be in fight, flight, or fright all the time.
Yeah, can't be on.
We need to really focus on what we're eating, like what we take into our bodies. If we're not taking the right nutrients into our bodies, then our bodies aren't going to function very well. That I need to be doing a certain amount of movement. I need to be sleeping a certain amount of hours every night. Otherwise, you can keep going for a certain amount of months, and I kept going like that probably for 12 or 18 months, but then I just hit the wall, and that's what I see with my patients. So it really kind of losing my health for a while, and then seeing how, when I took stock of that sort of stuff, and really learnt a lot about diet, and about meditation, and about down regulation and pacing, and I feel healthier at 45 than I've felt, I think, since I was 25. I really feel much, I feel so much better, and because I think with health, it can be this slow rot of losing your health.
Oh, 100%.
And, it tends to happen we finish uni, start playing sport.
Yeah. All the structures that we took for as granted.
Yeah, start getting a bit more senior in work, maybe get married, have kids, or whatever.
All these little compromises.
Get a mortgage, and we just start slowly, I can't play footy anymore because I need to stay at work, and, I'm trying to become partner in the firm or whatever it is, and it's this slow rot until suddenly like, shit, I'm 45 years old, my BMI is 32, I can't walk upstairs without puffing, or like we see this huge prevalence of autoimmune conditions and whatever it is. And so I guess that's really I think where my passion for health, on top of not just function but health, has become a kind of passion of mine. And I've got a huge network of people around me now where I can, and that's where this Western integrated health came from. It's about integrating health, and I refer a lot of my patients. I've got a huge network of clinical psychs who specialise in either chronic pain or cancer care or sports psychs, and dietitians, either that, really good at metabolic conditions. A lady next to me, there's a dietitian I work with who just treats cancer patients.
Yeah.
So it's kind of and that's so that's, I think that's really where the health, the passion for health came from. Kind of losing my own health and then
building it back up.
Yeah, building it back up and trying to use what I learnt from that experience to help my patients too.
Yeah.
Yeah.
What does the next 3 to 5 years look like for you?
Oh, it's a good question. I think for me, part of it is about maturing as a business too, like how to really build a business culture with a strong focus on patient-centered care. Like to really keep a small family feel type of clinic. Like to maintain that as the business expands, because it's the business is growing pretty quickly, and you want to maintaining that that real that culture that. So that's going to be an interesting challenge, I think, for me, because I like my patients, I know who their husbands or their wives are. I know their kids come in to see me. I've kind of got that it's like a real family feel. They bring me in presents on my kids' birthdays and that kind of stuff. So as a business is growing probably quicker than I'd anticipated, trying to maintain that, and also to maintain my spare time to spend with my family and maintaining my own health. And so it's a challenge that I wax and wane in and out of every week. You get that call from a doctor saying, "Can you squeeze someone in at the end of the day?" And it's like,
and particularly given, we're not talking about somebody turning up with a sprained ankle or knee. We're talking about, can you see somebody, and it could be life-changing, life-altering.
Yeah. So that's and kind of letting go of the brains too. Trusting other physios with my patients, because it's I've got it's not an average. It's quite a different treatment approach. Like I can't remember the last time I did manual therapy in a patient. It's been a long time, and people don't come out of physio school with that expectation. They come out with the expectation that what they'll do primarily will be some manual therapy and crack some joints and that sort of stuff. Yeah. So finding
fix people.
Yeah. So finding the right staff and then being able to let go of the reins a little bit and trust that
they'll do it.
That they'll care for my patients in the same way
that
I would. Yeah. So that's kind of my challenge over the next 3 to 5 years. But look, life. I've got to say, if nothing changes from the way it is right now, then over the next 5 years, I'll still be a pretty happy man, Bryn.
Excellent. So one of the last questions I ask my guests is, if you could take a little nugget of information and based on everything we're talking about and just load it up into the collective consciousness, so everyone just gets it.
Yeah.
What would that be?
I guess, for me, I think the take-home point from certainly my treatment philosophy for people would be that there's very few people for whom they can't improve their health, regardless of their diagnosis and regardless of what they may have been told, is that people can improve their health and their quality of life and their...
That's a really good point.
Yeah. So I think people just give up, or they don't, maybe they just haven't been told, or they just accept that this is their lot in life and that they have to accept being disabled and not being able to do things, and it's so, people's condition may put a cap on how far but most people can definitely improve their quality of life and improve their health even in the presence of some pretty horrendous conditions. Yeah.
And so I suppose if you take that outside of the sphere of what you focus on,
there's
a whole lot of people who really don't have any excuses.
Yeah. And also it just, if they're not doing it for themselves, like the ripple-on effect when someone gets healthy and engaged in life again, the way it just ripples through their family, because
having a community, everything.
The opposite, we think a few times about the snowball, the way these things snowball, and when there's an unwell person in the family, the way that has a huge effect on the family, and the way when someone starts getting better, the way that affects, and the way their kids, might be a parent, the way the kids see dad's overcome this condition. Like dad's got cancer, but he's still going down to the gym 3 times a week. He's exercising, and they're always going to remember that. And kids, they mirror their parents' behaviour more than what they see. So we just have I think there's a lot of people that, probably frustratingly from my point of view, have an opportunity to lead a much better quality of life that don't.
Or choose not to, or just perhaps don't know that they can. Jeremy, it's been absolutely fascinating listening to you today.
Thanks, Bryn. It's been my pleasure.
Often, particularly cancer is something that we've all had. We pretty much all know somebody or had somebody who's been touched by it.
Yeah.
And I think most of us have got an idea of, that means they're going to go and have chemo, and they're going to sit there and have stuff in, and they're going to be in a state and lose hair and look grey and all of that sort of stuff. But to actually, one of the reasons why I was really keen to talk to you was because it's actually something you can go and do about it.
Yeah.
And then you're dealing with the real end of it all. Not meaning the real end of life, but the real end as in people are probably being very real about, this is where I'm at and this is where I need to go. And to actually go and make a big impact in that area. And then to listen to what you said right at the end there, which is, it doesn't matter what state you're in, there's always something you can do.
Yeah.
And a big theme of the podcasts and the big theme of what I'm about and what WA Real about is there's always shit you can be taking responsibility for.
Yeah.
And as soon as you take that responsibility, then it's yours to control and play with.
Yeah.
And so you can go and do something.
Yeah.
And that has all these amazing snowball effects until, listening to you almost test that theory right at a really pointy end of, or part of life.
Yeah.
And it still seems to deliver the goods there.
Sure. I mean, Bryn, you'd be amazed. I take a falls and balance, like an exercise circuit group in a lifestyle village down at St Ives in Jollymont, and the average age in that group is probably 85 or 86, and I've got this circuit. We've got a gym there that I've set up through Lottery West, and the seeing what the people in that group do, and often their kids and their grandkids are horrified that, Nana's doing 1 minute high intensity bursts on these steppers and stamping your feet and standing on wobble boards and doing push-ups on the, against a bench and things like that. And, and you see the change in function that's been going for a couple of years in that group of people, and you realise, and there's people that have had strokes, they've, people with Alzheimer's, and had just about every joint replaced. And it really shows you that when people make a decision to improve their health or to do something positive for their health,
take responsibility, bring it in.
And particularly for, in that age group, people kind of write them off and they say, you stay there, Nana, I'll get you a cup of tea, and they almost kill them with kindness because they just...
wrap up cotton wool and watch them die.
Like 18 months later, and suddenly they're doing this pretty high level circuit. It's almost comical when you sit back and watch it sometimes, but really, it shows that back to that point, I think everyone can improve their health.
That and the whole slow rot that you don't see.
Yeah.
There we go. So if people want to find you, where can they find you?
Yep. So, I mean, the best way to reach out to me is probably through my website, which is wihealth.com.au, or they can certainly give the office a call as well. But certainly happy for people to reach out through the website. They can do an inquiry, and I'm happy to often give people a call on the way back from work just to chat to them about what I do, and they can so they really get a bit of a brief phone consult before they decide whether or not they want to book in to see me. Yeah.
Superb.
Thanks.
Again, Jeremy, thanks so much for your time.
Thanks, Bryn. Pleasure.
Excellent.
Thanks.